What is the most famous virus in Singapore? It would undoubtedly be the dengue fever virus. The dengue virus has been present in history for at least 1,000 years. The earliest documented cases trace back to the Jin dynasty in China. The earliest recorded instance of dengue fever in Singapore dates back to the year 1901. Unlike other infectious diseases, dengue virus cannot be directly transmitted from one infected person to another. The virus requires a mode of transportation, such as the Aedes aegypti or Aedes albopictus mosquitoes, to spread. Of course, not every mosquito carries the dengue virus. The dengue virus gained significant attention during World War II, a pivotal point in history. Due to the demands of the war, military forces in Southeast Asia often had to engage in combat in jungles and other challenging environments. These jungles were a paradise for mosquitoes. Once a primate is infected with the dengue virus, the mosquitoes can quickly transmit the virus to other primates. If a human enters this forested area, they could potentially carry the dengue virus out of the jungle. After years of dedicated research, scientists successfully isolated the dengue virus for the first time in 1952. Using serological methods, they identified the first and second serotypes of the dengue virus. Then, in 1956, in Manila, they isolated the third and fourth serotypes of the dengue virus from patients suffering from hemorrhagic diseases. I believe that many of you have had the experience of being bitten by mosquitoes. If that mosquito has previously bitten someone infected with the dengue virus before biting you, it could inadvertently introduce the virus into your body. The virus incubates in the body for a period of 3 to 14 days. Initially, during the onset of symptoms, patients may mistake it for a common cold. Subsequently, the body starts to experience fever, with temperatures reaching as high as 40 degrees Celsius within 24 hours. In some cases, after 3 to 5 days of fever, the temperature subsides and returns to normal, only to rise again 1 to 3 days later. Muscles and bones begin to ache, marking the acute febrile phase of dengue fever, which typically lasts for 2 to 7 days. If not treated promptly, patients may experience severe bone and muscle pain, to the point where movement becomes almost impossible. This stage is known as the critical phase of dengue fever and typically occurs between days 3 and 8 after symptoms first appear. Following the critical phase, there is a recovery period that lasts for 2 to 3 days. During this time, patients' conditions gradually improve. These symptoms characterize the mild to moderate form of dengue fever. In fact, what is most frightening is that there is no specific antiviral medication for dengue fever. The treatment mainly relies on methods like drinking plenty of warm water and physical methods to lower fever and relieve pain. If one is unfortunate enough to contract the disease, the duration of recovery largely depends on the resilience of their own immune system. Of course, there is a silver lining to being infected. From then on, you'll be immune to this particular type of dengue virus. However, this advantage should not be sought after, as there are 4 types of dengue virus. Being immune to one type doesn't protect you from the other 3. Moreover, in cases of secondary infection, individuals are at higher risk of developing severe dengue fever. At this stage, patients may experience severe headaches, cognitive impairment, and in extreme cases, central respiratory failure and hemorrhagic shock. According to the World Health Organization's estimates, there are approximately 100 million cases of dengue fever worldwide each year, leading to around 25,000 deaths. Approximately 3 billion people live in countries and regions where dengue virus transmission occurs. In 2010, France and Croatia experienced local transmission for the first time. Then, in 2012, an outbreak of dengue fever occurred in Madeira, Portugal, affecting over 2,000 individuals. Nowadays, many European countries observe local cases almost every year. Among travelers returning from low and middle-income countries, dengue fever is the second most diagnosed cause of illness after malaria. With urbanization and increased population movement between regions, the epidemic continues to escalate globally. dengue fever seems to be on the brink of becoming a global threat. In fact, when that time comes, the panic caused by the virus may far surpass the virus itself. At this point, there is an urgent need for vaccines and specific medications. However, the development of a dengue fever vaccine has been incredibly challenging. Building immunity against one serotype of the virus doesn't guarantee protection against infection from other serotypes. This difficulty has discouraged numerous pharmaceutical companies. Nonetheless, over the past 30 years, progress has been made in the field of vaccine development. Entering the 21st century, governments around the world have finally stepped in. A series of tests and research on drugs and vaccines have been able to continue. In December 9, 2015, the world's first dengue fever vaccine, developed by Sanofi, was launched in Mexico. However, it seems that this vaccine didn't perform as well as expected, with an overall efficacy of only 56%. It appears that physical defense is still crucial. As for prevention, any product containing DEET or mosquito repellent esters can be very effective in repelling mosquitoes. Also, it's advisable to avoid places with a high mosquito population and remember to use mosquito repellents in your living space.